Questions 701 to 720. 701. A nurse is assigned to care for a Muslim female emergency cesarean section. The patient asks to wear a head scarf during the surgery. Which of the following is the most appropriate? A. Ask the patient to remove the scarf. B. Tell the patient that it is okay to wear the scarf. C. Ask the patient to wear a surgical cap. D. Tell the patient that a request will be during the surgery. The answer is C. Ask the patient to wear a surgical cap. 702. A gravid 8 para 8 women has just delivered a 4.5 kilograms infant of pregnancy. Which of the following is a possible complication? A. Postpartum depression. B. Maternal hypoglycemia. C. Postpartum hemorrhage. D. Pregnancy-induced hypertension. The answer is C. Postpartum hemorrhage. 703. 62-year-old male patient in the cardiac surgery ward is admitted for the coronary artery bypass surgery. He has unstable angina for the past 1 year and is apprehensive about the open heart surgery. What essential assessment needs immediate attention? A. Fear and anxiety regarding procedure. B. Need for spirometer and breathing exercise. The answer is B. Need for spirometer and breathing exercise. 704. A patient was on a regular dose of lithium carbonate. The nurse that he has hand tremor, polyuria, diarrhea and vomiting. What immediate action should be taken by the nurse? A. Diuretics. B. Withholding lithium. C. Calling the psychiatrist. D. Monitoring serum lithium level. The answer is B. Withholding lithium. 705. Which of the following condition is a contraindication for a woman oral contraceptives? A. Dysmenorrhea. B. Menorrhagia. C. Thrombophlebitis. D. Toxic shock syndrome. The answer is C. Thrombophlebitis. 706. A 55-year-old man takes cyclosporin mg by mouth twice per day. He had a heart transplant 2 months ago. He complains of stomach cramping, diarrhea and muscle twitches. Which electrolyte is most likely elevated? A. Calcium. B. Sodium. C. Magnesium. D. Potassium. The answer is D. Potassium. 707. A conscious victim of a motor vehicle accident arrives at the emergency department. The patient is gasping for air, is extremely anxious, and has a deviated trachea. What diagnosis should the nurse anticipate? A. Pleural effusion. B. Tension pneumothorax. C. A pneumothorax. D. Cardiac tamponade. The answer is B. Tension pneumothorax. 708. Normal systolic BP for newborn. A. 40 to 60. B. 60 to 80. C. 80 to 100. D. 100 to 20. The answer is B. 60 to 80. 709. The doctor touched the bed by the sterile gloves the nurse should. A. Ask him to change the gloves and to give him new one. B. Let him to complete the central line procedure. The answer is A. Ask him to change the gloves and to give him new one. 710. Mr. Ahmed admitted to ICU with congestive heart disease. His vital signs BP 110/60 HR 120. Stroke volume 80. The nurse expected cardiac output to be A. 180. Born in 1700. Circa 2400. D. 9600. Cardiac output equals stroke volume x heart rate. The answer is D. 9600. 711. A nurse is leading an educational session on the correct use of oral contraceptives. One of the attendees asked the nurse what to do if she missed taking an oral contraceptive for 1 day. Which of the following should be the nurse advice to her? A. Continue as usual with no backup contraception. B. Take an active pill immediately and take the next pill at the usual time. C. Take 2 pills as soon as possible and then 1 pill daily at the usual time. D. Use backup contraception, such as a condom, for the next 7 days. The answer is B. Take an active pill immediately and take the next pill at the usual time. 7.12. Mother came with her baby with thalassemia. The nurse will monitor iron level and blank. The answer is chelation therapy with deferoxyrox or deferoxamine to prevent organ damage. 7.13. A woman is 5 weeks gestation diagnosed with hyperemesis gravidarum. What is the most important nursing action? A. Psychological support. B. Folic acid supplementation. C. Strict intake and output record. D. Providing the woman with a high-protein diet. The answer is C. Strict intake and output record. 7.14. A nurse is preparing to administer 25 mg iron dextran inject patient with iron deficiency anemia. The nurse knows this D to subcutaneous tissue and wants to administer the drug safely. Which of the best administration techniques? A. Z-track. B. Deep in C. C. Use large gauge. D. Insert needle at 45 angle. The answer is A. Z-track. 7.15. A surgical nurse is assigned to care for a woman who had undergone vaginal hysterectomy. The nurse performed assessment. Which of the following potential problem that the nurse should observe? A. Pain. B. Fever. C. Anxiety. D. Bladder dysfunction. The answer is D. Bladder dysfunction. 7.16. A 45-year-old man who is hospitalized feels the constant need to keep things in order, particularly whilst eating, and the nurse observe him arranging the food on his plate into symmetrical and equal bite-sized pieces. He constantly worries that the food served could be outdated and potentially causes illness. Which nursing diagnosis is most important? A. Ineffective verbal communication. B. Self-esteem disturbance. C. Impaired social interaction. D. Anxiety. The answer is D. Anxiety. 7.17. What do the standards of pain management dictate nurse do? A. Avoid the use of the word pain. B. Screen for pain at each encounter. C. Discourage around-the-clock dosage of analgesics. D. Administer analgesics via injection whenever possible. The answer is B. Screen for pain at each encounter. 7.18. Baby born at 35 week was admitted in neonatal intensive 27 hours ago. Physical examination revealed yellow discoloration sclera and mucous membrane. The result of bilirubin level every 170 moles. The infant was diagnosed with neonatal jaundice. Physician ordered to start single phototherapy. Which of following should the nurse consider as a priority during phototherapy of this newborn? A. Ensure proper fitting of eye covering, patches. B. Monitor bilirubin levels every 48 hours. C. Feed the infant formula every 4 to 5 hours. D. Avoid removing the infant from phototherapy. The answer is A. Ensure proper fitting of eye covering, patches. 7.19. 50-year-old male was diagnosed with subdural, underwent burr hole craniotomy for subdural hematoma days ago. In order to detect the sign of meningitis, as one of which of the following indicates the patient has meningitis? A. Negative Kernig signs. B. Positive Brudzinski sign. C. Absence of nuchal rigidity. D. Glasgow Coma scale of 14 points. The answer is B. Positive Brudzinski sign. 720. 10-year-old boy diagnosis appendicitis has severe pain. The tool of pain scale to be used is A. Face pain rating. B. A FLAC rating scale. The answer is A. Face pain rating.